just last week, I was at a veterinary conference specifically for ozone. Some stuff I knew, some stuff was new to me, and some stuff I knew but I'd never seen it done. And so I want to go over what is ozone and talk about a little bit of my experience on this, because unless you're in the world of integrative, holistic, you may not be familiar with ozone, and it could be the very thing not only messing your practice, but if you're a veterinary professional, but also as a pet owner, this could be the thing that is an adjunct in addition to help support your pet. And maybe you've heard the term floating around, maybe you haven't, maybe this is the first time. And so I am really excited to go into what ozone is and how I'm going to break it down for you. And so first I want to talk about like what ozone is. And so I've had it explained to me several times, and sometimes I think we hear it and we immediately picture like an atmosphere, or we picture something, and it may be true or it may not be. Or we maybe think of like an ozone bubbler for our fruit, or a purifier in our aunt's room. Medical and veterinary ozone can be a very different thing in the very best way. And so ozone is chemically written as O3. So think of an oxygen as O2. Ozone is O3. And it is a molecule essentially made of 3 oxygen atoms instead of the 2 that we normally breathe in. And so that extra oxygen atom is reactive, but in a good way. We want it to be reactive. This is the one time where being reactive is really, really good because it's therapeutic. And so in veterinary medicine specifically, ozone is produced using a medical grade ozone generator that converts pure oxygen, like an oxygen tank, into ozone. And so I have a specific veterinary machine that's got all these cool and cute little knobs on it and settings, and it's very intentional. It's not just like you turn it on and you have oxygen and boom, there you have ozone. It's very intentional on the amount of ozone that we're doing. And so then it's administered to the patient in a variety of different ways, which I am going to go over today, in controlled concentrations, precise locations, maybe precise administration, precise frequency. And that concentration is critical. And it's very, very important. And that's how I was taught as well, is that it's very, very important. And so we'll talk about that as well. So one thing emphasized at the conference was that it's not necessarily a drug. It's more of like a biological response modifier. It is helping the body be supported. It is helping the immune system. It is helping detox. And so it doesn't act like an antibiotic or steroid. It's actually quite different. And so it targets a specific pathway depending on how it's administered. So it signals that the body can heal itself more effectively. It's like kind of reminding the body like, hey, you were designed to do this. Let me be that reminder for you. And so it upregulates antioxidants, which we love, right? It supports the immune function, and it improves oxygen utilization at the cellular level. Again, maybe you've heard of like hyperbaric chambers. So we want to really utilize that oxygen. So it's actually pretty fascinating when you think about this gas that you can't even see, that some people can smell. It's a very distinct odor, can do so much. And so I do want to get a little nerdy for a second because I am a closet nerd. And so when ozone contacts biological tissue or fluids, so your dog, your cat, it reacts almost immediately in what are called reactive oxygen species. Again, this is the type of reactivity we do want. And so it sounds scary, right? Because we hear like oxidative stress or reactive species, and we're like, oh my gosh, I don't want that. But it's so small and controlled amount that it's actually beneficial. So it acts like a messenger to trigger a cascade of a healing response. It is like that, again, that reminder to the body like, hey, you can do this. And so we talked about a variety of ways to use it at this conference in the bladder, rectal ozone, bagging limbs for wounds, injections. And so it has very strong, very important antimicrobial, while it's not an antibiotic, antimicrobial action. Because it is a very powerful antimicrobial, because it is effective against bacteria. I guess you could even say it's antimicrobial, but also antiviral, antifungal in how it attacks these. Maybe even some parasites potentially, or just supporting the immune system. The key here though is, unlike antibiotics or microorganisms, they can't develop resistance to ozone. And it's not like, well, an antibiotic, we have to use a specific antibiotic because of a certain type of bacteria. Is it gram-negative, gram-positive? Or where these antibiotics are filtered through, where they filter through the kidneys or the liver. And so if you're using an antibiotic that's filtered through the liver, but you want it to reach the bladder and the kidneys, it may not be your right ideal. So there's definitely, antibiotics are not just antibiotics. You have to be very intricate on which ones you're choosing and how they're targeting what you're wanting to target. So if you're targeting it for a certain type of bacteria, that antibiotic better cover that type of bacteria. And so what the ozone does in this sense is that these typically the bacteria that we want that are forming like biofilms that are really, really bad, their wall is very different. And so that extra oxygen molecule goes in and captures it in a way that we want it to. It can help with the immune modulation in a good way. So ozone helps like recalibrate, remind the immune system. So for conditions involving chronic inflammation, allergies, arthritis, ear issues, cancer, inflammatory bowel disease, something that has got chronic inflammation or immune dysregulation, it can be really, really meaningful, really, really beneficial to support that pet. Improved oxygenation is also a wonderful thing that it can do. And so ozone therapy enhances the release of oxygen from the red blood cells into the tissue. So it's tied to something called a Bohr effect. And because oxygenation at the tissue level means better healing. So again, it helps bring it there. Again, depending on which route we are administering it. And then it helps stimulate antioxidant enzymes. So while it's technically an antioxidant, it does stimulate the body's own antioxidant defense systems, like superoxidase dismutase, glutathione. And so again, very intentional, it can be very supportive. And so while it gets really, really exciting is that there are so many ways your pets can be supported with this. And it really just depends on how we are administering it and how often we're administering it and the concentration we're administering it. And so it is being used in a variety of conditions. I saw ways that I had read about it being used, but never really seen it or used it in person. I haven't had a case yet, or we haven't moved forward with it. And so wound care is really, really cool. You can bag limbs, you can apply it topically in maybe a glycerin form or an oil form. And so ozonated oils, ozonated waters, again, ozonated gas if you're bagging, are used topically on wounds, hot spots, maybe a wound that's not healing, a burn, a lick granuloma. Ear infections, you can infuse it into the ears with a certain type of attachment. Post-surgical sites, and the antimicrobial and tissue regenerating properties make it really effective here. Again, you don't have to worry about this being an antibiotic. I'm not demonizing antibiotics. I'm saying this can be a wonderful tool in the toolbox. Or if we're like, gosh, my pet has been on so many rounds of antibiotics, where every time they're on antibiotics, X, Y, and Z happens. And again, we have to remember antibiotics can cause a downstream effect later on in the gut microbiome. I'm not saying we don't use antibiotics. I'm saying we need to be really, really intentional rather than just throwing antibiotics at conditions. Dental disease. It is being used in veterinary dentistry to treat periodontal disease in dentals, to rinse these mouths with. You can add it to pets' water in a specific formulation for them. It can help penetrate that biofilm. Now there's good bacteria in the mouth and there's bad bacteria. So it can help penetrate the biofilm, which is basically what bad bacteria make. The way I like imagining it, have you ever been in a shower and there's been that like pink mildew and it's really slippery if you get in? Have you walked on it and you've always like landed on your tushy? So you don't have a good grip. And so that's what the biofilm is. Biofilm is that it prevents a really good grip of the good. And so that it's like a sticky bacterial layer on the teeth that we don't want, or in the gut, or wherever this may be that we're talking about. It can be used, and I've never done this, and this is where I saw it. It can be used in injections. You can use it in acupuncture points, so really good for musculoskeletal or arthritic conditions. You can combine it with nutrients like B12 or procaine, injecting it whether into an acupuncture point. You can, if you're brave enough to inject the joint. Some of us say we're like, we don't inject joints. It's not something just that we do. And so it can definitely help with joint pain, tendon or ligament issues. And so the idea is to reduce the inflammation and reduce the stimulus that the immune system, maybe even the nervous system, is having here because of that constant stimulation of being on and over. Ear infections and if you're a veterinary professional, otitis. It definitely can be very, very beneficial. Saw a puppy have ozone done. And so you don't ever put direct ozone gas into the ears. You always want to make it and bubble it with ozone and make it like an ozone oil. Again, very, very intentional, very, very specific. Do not go and take your ozone bubbler that you use for your fruits and your vegetables to clean them and put them in your pet's ears. Do not do that. That is not what we do around here. And so chronic recurrent ear infections, ones that won't get better, or owners that are like, hey, I'd like to see if I can avoid the topical medications, especially those resistant. It can be treated with ozone very, very intentionally. Gastrointestinal issues, absolutely. So rectal insufflation, this is what I do a lot of. And this is where ozone gas is introduced, sedation-free, almost like giving an enema, except we're doing essentially a gas enema. And it is absorbed into the circulation because of the portal circulation system. And it is being used for IBD. It can be used for leaky gut, liver dysfunction, lymphoma, anything systemic that you want the body to get. And here's a really cool thing about ozone, is that almost all the pets I saw getting ozone a different way. Maybe it was bladder insuffusions, it was bladder installations, it was limb bagging. You can still do rectal ozone. So you're like really giving a really good dose of this oxygenation to this pet. Cancer support. So it is not a cancer treatment. It does not replace chemo for like lymphoma by any means. It is a tool in the toolbox. And so no one at the conference was claiming that, hey, instead of doing chemo, do ozone. No. We're saying that it's something to help support them. It is something that is supposed to be in a tool, again, in the toolbox. It is definitely used as a adjunct. It is definitely used as in addition to conventional therapy to help improve quality of life, to help improve outcomes, to help support the immune system, which is so important in cancer, and maybe even reduce the side effects of chemotherapy. In fact, right now I have a patient who is undergoing chemotherapy, and we are doing rectal ozone on him, and we are going to be doing fecal transplants on him once a month to help support his immune system. Chronic infections, immune-compromised patients, FIV cats, chronic Lyme cases, recurrent UTIs, recurrent skin issues, broad spectrum ozone can really be an interesting tool here to start using. In fact, I have a patient who has had chronic skin issues for years. And this dog's skin, you can't miss it when you look at it. And we're doing fecal transplant on her, and we're doing ozone, and we're starting to see new hair growth. And her skin that is like really crusty and thick is starting to improve too visually. It's really, really exciting. So I'm going to talk about a few ways about how you can use ozone. So there's ozonated water. So this can be used topically or as a wound rinse. But shelf life is typically short, and so you want to use it when it's fresh. Ozonated oils, so like combined with olive oil. It can be infused. So these can be topically. They can be for ear treatments. They can be for wound treatments. It really just depends on how you are mixing it as well. There is ozonated glycerin. So glycerin, this is different than like an ozonated oil. So ozonated glycerin. So that can be used into the bladder. You want to definitely buffer it with something to help with the pH of it. And this is going a little bit on the science side, but there are so many different ways, and this can be used into injecting it into the body. It can be injected into the bladder. So it really is very, very specific on how we are doing this. There is minor autochemotherapy. So a small amount of your pet's blood is drawn and mixed with ozone, and then it's reinfused. Typically this is like for systemic support, maybe allergies, cancer support. And so this is typically given like under the skin. Then there's major autochemotherapy, where a larger volume of blood is pulled and again combined with ozone saline. Maybe a small amount of gas, but the bubbles are removed. And then you are giving this IV. This is more serious conditions. This is great for skin and allergies as well. There's rectal insufflation, which we talked about. So ozone gas is introduced in the colon via the rectum, sedation-free, well absorbed, and has very, very good systemic effects. There's ear insufflation. Like I said, it almost looks like a stethoscope that you put in the pet's ear, and then you're using ozonated oil to do this. You can have them nebulize it. You can bag a leg. You can do direct injection into trigger points. Again, acupuncture, subcutaneous fluids. And so the consensus though at the conference was like rectal ozone. Like absolutely, you can do that. And then you can do targeted depending on what this patient needs. And so as far as safety, the most important thing is that it should never be inhaled. Ever, 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 especially directly. So we don't want to do that. And concentration matters enormously. I bought my ozone machine from Regenevet, which is Dr. Jill Rubin's company. And it is, once you understand how to use it and your dials, it is a set and forget. Like you just put your dials and you move your oxygen at a certain concentration, and it does it for you. It is so, so beautiful because concentration matters. And effective therapeutic ranges are very, very dependent on the species and the application of what we're using. We don't want to go too high. It doesn't mean more effective. This is not where more is better. Better is better. And so equipment quality is critical. You want to use medical grade ozone, which is what I have. You want to use certain type of syringes. You want to use certain type of catheters. So it's very, very intentional. In fact, at the conference, one of the doctors had a latex glove or just a glove on. I don't know if it was latex or not. I think it was just like a exam glove. And she put it next to the ozone and you saw it like literally ripped her glove. So you have to be very, very intentional on the equipment that you're using. So I have very intentional catheters that I use. I have very intentional syringes that I use so that they are not degrading, especially with the world of microplastics that we live in. So it is safe, especially when used by trained professionals in it as well. And so one of the most energizing parts of the conference was the conversation around research and where it's heading and hearing these cases that have improved. I'm seeing it with my own cases. There's a lot of evidence that's still building, but that's science. Things are always changing and evolving as well. And so what is driving is clinical experience, case reports, and extrapolation from the human side. In fact, next month, a lot of the veterinarians that were there were talking about how they were going to a human ozone conference, and there is a veterinary section of this conference now. It used to just be human, and now there is a section, and some of these veterinarians that were there are speaking at the conference. And so it's really, really cool to see what is changing and what is coming about in the research that is actively going on to utilize this in veterinary specific studies. And so it's also really cool to see how it is growing in an integrating zone with multimodal treatment. So meaning that, how you can use it in various ways on the same patient. You can do acupuncture and then you can do rectal ozone, or you're treating the bladder and you do rectal, or you're doing ears and rectal, or ozone acupuncture and limb bagging. It's really, really cool to see the different modalities that are going on. And so from the pet owner side, I do think there's an increasing demand. People are looking for options that are less reliant on antibiotics, that have fewer side effects, and maybe take a whole body approach. And I think this is a wonderful tool that can do that, and it fits in that conversation so very well. So what I want you to take away from this episode on ozone is that it is a legitimate science-based, science-backed modality that works through biological signaling, and it can work in so many ways, and to reduce infection, support healing, support their immune system. It has real clinical application across wound care, dentistry, ears, joints, immune support. My dog, I give him rectal ozone once a month for just overall immune support. And it is absolutely safe when it is used by a professional who is trained in it and familiar with it and knows how to use it. So if you're a pet owner and you're curious like whether ozone may be helpful for your pet, I'd encourage you to find a veterinarian who is familiar with it. And the reason I say that is if you ask a veterinarian who's not familiar with it, they'll probably be like, we don't know, or they may be misinformed on the information. It should be like if you came to me and asked me how to build a diesel engine, I'll be like, I don't know. I just know that I have driven diesel trucks. I don't know. And so I'm not the best person to ask for that. And I know that. And if you are a clinician or a vet tech listening to this, I'd love to hear your experience. Are you familiar with it? Are you using it? Are you curious about it as well? And so it is another tool in our toolbox to help support our pets, to help them have better outcomes, to help them live better. So hopefully they can live longer with you.